When engaging with a new client, it is important to make sure you are conducting a proper pre-participation screen to keep them safe and healthy. Doing so will help you to identify whether or not they need medical clearance to begin participating and to determine at what intensity they can begin exercising. In this video, you will learn how to accomplish this by understanding how to use the ACSM screening algorithm. What do you do if a new client has a pre-existing health condition? What are the health conditions that are important to consider? Can a new client jump into a new high-intensity interval training routine? What's the right starting intensity? Where do you begin with a new client? What information do you need, and how will you use that information to make decisions about your client's program? After watching this video, you will be able to explain how to use the ACSM screening algorithm. The ACSM screening algorithm tells you whether or not a new client needs medical clearance to begin exercising with you, and at what intensity they can begin exercising with you. First, we will define what it means to be physically active. Next, we will discuss the PAR-Q+ and how to use it to evaluate a new client for history of cardiovascular, metabolic, and renal disease. Then we will discuss how to evaluate a new client for signs and symptoms suggestive of cardiovascular, metabolic, or renal disease. Finally, we will review how to use this information in the implementation of the ACSM screening algorithm to determine how to proceed with a new client. A client is defined as being physically active if they exercise in 30 minutes per day, 3 days per week, for a minimum of the preceding 3 months, at a moderate intensity. If a client does achieve these minimums, you can record the frequency, intensity, and time of exercise. If a client does not achieve any of these minimums, they are not considered physically active. They must check all of the boxes specifically for cardiovascular exercise, excluding resistance training. The front page of the PAR-Q+ asks 7 questions related to health history. If your client answers no to all of those, you would consider them to not have no history of cardiovascular, metabolic, or renal disease. If a client answers yes to any of these questions, they are considered to have a history of disease. This has implications for the ACSM screening algorithm. The ACSM provides you with a list of signs and symptoms suggestive of cardiovascular, metabolic, and renal disease. This is an example of a generic table describing each one, but you would need to explain in simple terms what each sign or symptom refers to. Instead of what is written here, you might ask your new client if they have chest or arm pain, experience fainting, have unexplained ankle swelling, unexplained lower leg pain, lose their breath with light activity, lose their breath without moving, feel like their heart flutters or have a resting heart rate greater than 100 beats per minute, have been diagnosed with heart murmur, or lose their breath when they're lying down or sleeping. Similar to the PAR-Q, if your client states they have one or more signs or symptoms of disease, there are implications for the ACSM screening algorithm. One final note, signs and symptoms of disease should not be confused with risk factors for cardiovascular disease, which are separate though potentially related. To review, first we establish whether or not our client is physically active. We can record that both as yes, no, and amount of physical activity they do. Then we use the front page of the PAR-Q to evaluate for existing cardiovascular, metabolic, or renal disease. We can record that answer as yes, no. Next, we evaluate the client for signs and symptoms suggestive of disease by explaining the ACSM criteria in plain language. We record the answer as yes, no. Now, it's time to use our results to implement the ACSM screening algorithm. The physical activity criteria lives at the top of the algorithm. First, we will follow the path for someone who does not meet the minimum criteria. If a new client does not meet the physical activity criteria, but has no history or signs or symptoms of disease, they may begin exercising with you at a light to moderate intensity. If a new client does not meet the physical activity criteria and has known disease, but is asymptomatic, they should seek medical clearance before exercising with you. Once cleared, they may begin exercising at light to moderate intensity. I'm going to skip over the next route and move to the yes part of the algorithm. If a new client meets the physical activity criteria and has no history or signs or symptoms of disease, they may continue exercising with you at or above the intensity they have already been exercising at. If a new client meets the physical activity criteria but has known disease and is asymptomatic, then they may continue exercising at the same intensity they have already been exercising at. They should continue to seek medical clearance annually or if symptoms change. If a client demonstrates signs or symptoms of disease, they must seek medical clearance regardless of whether or not they meet the criteria for being physically active. Once cleared, a client who does not meet the minimums may begin at light to moderate intensity, and a client who does meet the minimums may return to the same level of intensity they have already been exercising at. The ACSM screening algorithm is how to determine whether a new client is healthy enough to begin exercising with you. The algorithm tells you at what intensity the client can begin exercising with you. Keep your new client safe and healthy by using the ACSM screening algorithm as part of your pre-participation screen. Minimize your new client's risk of experiencing a major health event by implementing the algorithm. For more information about the ACSM screening algorithm, review Chapter 11 in ACSM's Resources for the Personal Trainer 5th edition.